This presentation is about vitamin B6. There are three forms of vitamin B6: pyridoxal, pyridoxine, and pyridoxamine. The primary active coenzyme is pyridoxal phosphate, or PLP. Vitamin B6 is converted to PLP by adding a phosphate group to its hydroxyl group. Vitamin B6 is stored in muscle tissues of animals, which means meat, fish, and poultry are some of the richest sources of vitamin B6. Whole grains are also a good source, but some of it is lost during the refining of grains. And generally, fruits and vegetables are not a good source, but there is an exception. Carrots, potatoes, spinach, bananas, and avocados do have a good source of vitamin B6. The RDA is that it is 1.3 milligrams per day for men and women, and in adults past 50, the RDA increases to 1.7 milligrams per day for men and 1.5 milligrams per day for women. The average intake in the United States is 2.5 milligrams for men and 1.7 milligrams for women. The upper levels for adults is 100 milligrams per day, and excessive intake can lead to irreversible nerve damage. One of the main functions of vitamin B6 has to do with metabolism. PLP transfers amino groups to allow the synthesis of non-essential amino acids. Without PLP, every amino acid would have to be essential. PLP helps convert homocysteine to cysteine, which keeps the homocysteine blood levels low and protects from homocysteine's toxic consequences. PLP is required for the release of glucose from glycogen and helps maintain blood glucose concentrations. Vitamin B6 also has to do with the synthesis of compounds. In red blood cells, PLP catalyzes a step in the heme synthesis, which is a ring in some proteins that hold iron. An example of this is hemoglobin. PLP is required for neurotransmitter synthesis. Some examples of this is serotonin, dopamine, norepinephrine, and gamma-aminobutyric acid. It also plays a role in niacin synthesis. Some additional functions is that it helps support normal immune function and regulation of gene expression. It may also help prevent colon cancer because increases intake in blood levels had a lower risk of colorectal cancer. Vitamin B6 deficiency is generally rare in North America. Some of the symptoms is seborrheic dermatitis, microcystic hepatochromic anemia, convulsions, depression, and confusion. Medications could also decrease the amount of PLP in the blood. Some examples of this is medication for Parkinson's disease, anti-tuberculosis, and asthma. The pharmacological use of B6 is that it's successful in treatment for carpal tunnel syndrome and nausea during pregnancy, but the relationship to carpal tunnel syndrome is unclear, where it either repairs damaged nerves or reduces pain perceptions. The journal article found was that vitamin B6 may help prevent colorectal cancer in women. The high intake of vitamin B6 may result in a lower risk of colon or rectum cancer. The researchers analyzed blood samples taken in 1989 from 33,000 women. They measured levels of PLP in women who later developed colorectal cancer or polyps and who remained free of these conditions. The results were that those with the highest levels of PLP had the lowest incidence of colorectal cancer and polyps. The total B6 intake was inversely related to the likelihood of developing colorectal cancer, and that those lowest with those who were consumed with the most vitamin B6 were 8.6 milligrams per day, which is about 5 times the recommended daily amount.